As promised, Republicans in Congress Thursday began the process of dismantling the Affordable Care Act, also known as Obamacare. That will be the easy part. The hard part is agreeing what to replace it with and figuring out the nut that always bedevils health care reform. The sickest 10% of people account for about 2/3 of all health spending. And someone has to pay. Joining us to discuss is WSJ health policy reporter Louise Radnofsky from our Washington bureau. Welcome, Louise. Great to see you.
Thank you for having me.
Is it an exaggeration to say that sick people who do not have coverage through an employer or a government plan are one of the biggest problems facing Congress right now?
They are. The healthcare economics are remarkably bipartisan. The solutions people can divide over on party lines, but what you do about people who have pre-existing conditions, who number 133 million across the country, according to one estimate, but really provide the most acute problem when they're buying health policies on their own. That's what Congress has to work on right now.
And of course, this was one of the most popular parts of Obamacare, the fact that people with pre-existing conditions could not be denied coverage. So are you hearing that pretty much both sides of the aisle are agreeing that this will at least remain?
No, what we're hearing is that both sides of the aisle agree that you have to do something for people with pre-existing conditions. The way the Affordable Care Act went about doing this was to ensure that insurers provided coverage to everybody at the same price, regardless of their medical history. And the effect of this was that healthy people paid more. They were effectively subsidizing the coverage and the care of sicker people through their premiums. This is one way of doing it. There are other ways of doing it that Republicans are considering. What Republicans need to know going forward is that going about any of those provisions also carries with it the risk of a significant downside and unpopularity and backlash.
Well, let's talk about the problem of having healthy people sort of subsidize the sicker people. They apparently then drop out, right? This was something that Obamacare struggled with, didn't it?
Over time, they can drop out. They can believe that the premiums are too high for coverage that they effectively don't believe that they need. And in the case of the Affordable Care Act, the requirement for most Americans to get coverage or pay a penalty wasn't particularly strong. And as a result, people didn't feel incentivized to buy. Now, what Republicans are considering are a couple of other ways of incentivizing people to buy coverage. One is called a continuous coverage guarantee. That means that you would pay the same price as anybody else, regardless of your medical history, as long as you could prove that you'd maintained coverage on a continuous basis. Now, this, some critics have said, has the same kind of penalties as the so-called individual mandate in the Affordable Care Act that people don't like. On the other hand, it's one of the ways that you can address the question of pre-existing conditions. Having it all is not an option.
Right. Now let's talk about some of the other ways. Insurers could just charge sick people more, or taxpayers could pick up the extra costs. But both of those ideas are politically fraught, correct?
They are. The former is the world before the Affordable Care Act was passed. Republicans who are seeking to remake the Affordable Care Act now say they don't want to go back to that, and of course Democrats don't either. So let's assume that that option's off the table. The second option that you just mentioned is where you effectively segregate people with higher medical costs into specific groups of other people who have similar costs. These are often called high-risk pools. They are very expensive because you can't charge people the full premium for what their actual medical care would entail. So in that case, it's taxpayers who are picking up the extra costs. The states or the federal government ends up subsidizing those pools.
Now, is there also a replacement plan under consideration that includes the plans that states once used to cover high-risk patients?
That would be this Republican idea that you could put people into state high-risk pools or federally run high-risk pools and pick up the difference. There are two problems. One is that taxpayers don't always want to fund them. And the other problem is that the people who are in those pools don't always want to be there. Many of the people we spoke to for the story had experience of the high-risk pools, and they felt as if they'd been made to feel like they were pariah in some cases because their pre-existing condition, they pointed out, was not anything they had any control over.
Now, Louise, is anyone putting on the table any kind of legislation that might explore the issue of pricing? Not so much who's going to pay for it, but how can we bring costs down across the board?
most of the healthcare overhaul legislation that's been debated over the years focuses on coverage first, with the idea that over time it might help bring down healthcare costs if more people had coverage. There are a handful of Republicans who say that pursuing coverage is the wrong goal, but Republicans are somewhat locked into the debate as set up by Democrats going in because they passed the Affordable Care Act, that if they are trying to do away with the Affordable Care Act, they have to then address the fallout. And in the case of that, it would be the loss of health insurance for millions of people. So they're sort of stuck with the coverage issue for the time being, even if they would rather be focusing on costs.
Definitely going to be a difficult topic going forward. Thank you so much, Louise, for that.
Thank you.